If you've ever brought a new cat into your home, you know how exciting it is to welcome them into your family. They're cute, cuddly, and filled with endless energy. But, as any experienced cat owner will tell you, there's more to caring for a cat than just feeding and playing with them. You want to make sure they're healthy and protected from diseases that could potentially affect their quality of life. One of the biggest concerns for cat owners is FIV and FeLV, two viral infections that can affect your cat's overall health. You may have heard of these viruses, but what do they actually mean for your cat? How do they affect your feline friend? If you're wondering whether FIV or FeLV are something you should worry about, stick around. I'm about to explain everything you need to know about these two conditions, how they spread, what signs to look for, and how to protect your cat from them. Let's start by breaking down what FIV and FeLV are all about. Feline Immunodeficiency Virus, FIV, commonly referred to as feline AIDS, sounds pretty scary, but it's not as bad as it seems. Now, don't be alarmed by the name. It might make you think it's the equivalent of HIV in humans, but the reality is a little different. FIV is a virus that affects your cat's immune system. It weakens the body's ability to fight off infections, which means cats with FIV are at higher risk for a variety of health problems. But here's the important part. FIV is not contagious to humans or other animals, including dogs. It only affects cats. You might be wondering how a cat could get FIV. FIV is primarily transmitted through bite wounds, especially during fights between cats. Outdoor cats or cats that live in shelters or multi-cat households are at a higher risk because they're more likely to get into scuffles. It's important to note that while FIV can spread through bite wounds, it's very unlikely to be transmitted through shared food bowls or grooming. Cats need to bite one another with force for the virus to be passed along. One thing that's important to keep in mind about FIV is that it's a slow-progressing virus. A cat infected with FIV might not show any symptoms for months or even years, and they can lead a relatively normal life. But as time goes on, the virus can start weakening their immune system, making them more susceptible to other infections like respiratory issues, gum disease, and other illnesses. So, how do you know if your cat has FIV? Well, the tricky part is that many cats with FIV show no symptoms at all for a long time. But there are some signs to watch for that might indicate your cat is suffering from FIV. These include weight loss. If your cat starts losing weight despite eating regularly, it might be a sign their immune system is being compromised. Lethargy. FIV can make your cat feel tired all the time. If your usually energetic kitty starts acting sluggish, it could be related to FIV. Frequent infections. Cats with FIV tend to develop more infections, especially in their mouth, gums, or respiratory system. If you notice your cat has ongoing health issues, it might be a sign. Swollen lymph nodes. If your cat's lymph nodes, those little bean-shaped structures under the skin, are swollen, it's another red flag. FIV can also cause gingivitis, which is inflammation of the gums. This can result in bad breath, difficulty eating, and bleeding in the mouth. If you see any of these symptoms, it's crucial to visit the vet for a proper diagnosis. Now let's talk about FeLV, which stands for Feline Leukemia Virus. Unlike FIV, FeLV can cause more severe health problems and is often linked to cancer and anemia in cats. FeLV is a rapidly progressing virus, meaning it can have a much quicker and more noticeable impact on your cat's health. It's spread primarily through saliva, so cats that groom each other or share food bowls are at risk. It can also be transmitted via bite wounds or from a mother cat to her kittens during pregnancy or nursing. FeLV can seriously damage a cat's immune system, much like FIV, but in a faster and more aggressive way. Cats with FeLV are much more prone to developing severe health conditions like cancer, anemia, or immune system failure. FeLV can be hard to detect early on, just like FIV. It's often asymptomatic in the early stages, meaning that your cat may not show obvious signs until the virus has caused significant damage. Here are some symptoms you might see if your cat has FeLV: loss of appetite and weight loss. Cats with FeLV may lose interest in food, causing them to lose weight quickly. Lethargy. FeLV can cause extreme tiredness. Your cat might seem sluggish, less active, or unable to keep up with their usual routine. Frequent infections. FELV makes your cat more susceptible to respiratory infections, skin infections, and even oral diseases. If your cat is always sick, this is something to be concerned about. Fever. Cats with FELV often run a fever that lasts for days or weeks. Swollen lymph nodes. Just like with FIV, swollen lymph nodes can indicate an ongoing infection or virus. If you see any of these symptoms, it's crucial to get your cat checked out by a vet. FELV is a serious condition, but early detection can make all the difference in treatment and your cat's quality of life. As a cat owner, one of your top priorities should be protecting your cat from FIV and FELV. Luckily, there are several ways to minimize the risk of exposure to these viruses. Vaccinate your cat. For FELV, there is a vaccine that can protect your cat from the virus. Talk to your vet about getting the vaccine, especially if your cat goes outside or is at risk of coming into contact with infected cats. Keep your cat indoors. The best way to protect your cat from both FIV and FELV is to keep them indoors. Outdoor cats are at much higher risk of being exposed to the viruses, so keeping them inside can significantly lower their risk of infection. Get your cat tested. If your cat is in a high-risk situation, get them tested for FIV and FELV. Testing early can help catch these viruses before they cause any serious damage. Monitor your cat's health. Keep an eye on your cat's overall well-being. Look out for any changes in their behavior or health, and don't hesitate to reach out to your vet if something doesn't seem right. Limit exposure to other cats. If your cat does interact with other cats, try to make sure that those cats are healthy and free of viruses. If you suspect that your cat has FIV or FELV, don't wait. The sooner you see a vet, the sooner you can take action to manage the condition and preserve their quality of life. FIV and FELV may sound scary, but with the right care, your cat can still live a happy, comfortable life. Your vet will likely perform a blood test to diagnose FIV or FELV. If your cat tests positive, don't panic. Many cats with FIV or FELV live for years with the right care. Regular vet visits and proactive health management will ensure that your cat is as healthy as possible. As a cat owner, it's crucial to stay informed about the potential health risks your cat may face. FIV and FELV are two serious viruses, but knowledge is power. You can protect your cat by understanding the risks, keeping them indoors, getting them vaccinated, and monitoring their health. Remember, your cat relies on you for protection, and with a little bit of attention and care, they can live a long, healthy life, even if they're dealing with FIV or FELV. Stay vigilant, keep them healthy, and never hesitate to reach out to your vet if you notice any changes in your cat's health. If you found this information helpful and want more tips on keeping your furry friend healthy, don't forget to subscribe. Together, we can help our cats live their best lives.